Sisi yao ndio kuingia studio. Stano ndio huyo hapa. So tutakuwa live on TikTok leo, being a New Year's, tunaanza na one of the most amazing guests mtaisikia. His name is Stanley Aruyaru. Stanley Aruyaru is an author, he's a surgeon, laparoscopic and general. He does amazing things. I mean, he's a medical director, uko PCA. He has worked in many mission hospitals. He's a mentor, a leader, a public. The list goes on. It's going to be amazing. We'll be live on TikTok. Kama kawaida, like, comment, follow, share. Kuja muone huku kwenye studio pali tuna shoot the live content. It's going to be amazing. Stano, on the ones and twos, this is where we'll be. TikTok ina go live hapo. Sisi yao hapo. Okay? Yeah, so my guests will be here and we will do some amazing work. So stay tuned, maze. Fly. All right. Daktari Akwikwan, it's a happy new year. It's 2025. Mambo lualua. Kama Steve Simple Boy. Mambo iko freshi barida. So this is a new year and I hope you're going to have an amazing year with you guys. You're going to grow. And what better way to kick the new year off with this brilliant gentleman seated next to me. Huyu CV yake inaanzia Tigania, inaenda mpaka Timbuktu, inarudi. It's a very long one and I'm actually humble. I'm very excited for this episode, Doc. So karibu sana, and I'm actually happy that we were to do this last year.
Yes.
But tumeanza nayo mwaka and
yes.
I like that even better.
Daktari Akwikwan. Thank you so much for having me.
So welcome to Akwikwan.
Yes.
Where we do some long videos though.
Long? Okay, no problem.
Yeah, but yeah, so
we will tolerate.
Yeah.
Thank you for having me. And I'm looking forward to enjoying myself.
Yeah. We try to have fun. We try to have free-flowing conversations.
Fun and surgeon, not in the same sentence, but we'll try.
Really? Wait, you mean it's not fun being a surgeon? Okay.
No, but surgeons are scary. So
Scared?
I think the only place we can have fun is in the operating room. Because then no one is really scared. But when someone is told that guy is a surgeon, the last thing you expect is fun. You expect seriousness.
You expect a very serious person.
Then life and death situations, blood, sweat and tears, literally or not literally, and other body fluids. So it can be scary to people, but of course not to those of us in the craft.
Exactly. Those in the craft know that surgeons are the biggest jokers out there. You are.
It's okay. It remains to be determined. The jury is still out.
I think surgeons are very easygoing. Most of the ones I've met.
Okay.
They're easygoing, very sociable. But there are some people out there who are, by the books in some professions that you won't name.
It depends on which, we call it catchment. It depends on your sampling and where you've sampled. Yeah, probably. But I guess it's just a spectrum of human behavior and spectrum of personalities. But you might find that surgeons lack in patience. You might find certain attributes going across. The swiftness and the decisiveness and the impatience, because those are the more or less ways or innate subconscious traits that we've been cultivating in our training and how we've been socialized, because you are there in the high adrenaline space of saving life, or it's either
so
you
when things
act swiftly or patient dies.
When things are a bit slow,
so when people are slow, you're like, it's boring
you.
in here. Can't we do something serious?
Wait, so let me ask you, now that you've brought up the person, okay, now we've already established he's a surgeon. That's part of introduction. So now, we've just jumped right into it. So now, these issues, I don't want it to go away, personality and career paths. Do you think your personality determines your career path, or your career path will shape your personality? Because now you're saying surgeons are a bit impatient in their nature. Were they impatient before? That's why they tended towards this? Or is it the nature of the craft that has, folded them into...
Interesting. I think it's nature-nurture question that you can't quite separate the nature and the nurture.
You wouldn't know, is it the
You wouldn't know
egg or the chicken?
Egg or the chicken.
Which
So
one
you
came
would
first?
say someone was born maybe clumsy and lazy and slow, and then that was beaten out of them when they went through the surgical training. Or someone was always, quick and swift and impatient of sorts, and that's how they drifted into this because it fitted them. But I think there are enough research out there, and I invite viewers to watch and read that look at the personality of residents during the matching of the programs. I think I think I've read some around there, so that you can say this type of personality could be drifting towards this. But granted, even if you go down to the undergraduate studies, the personality that takes medicine is often, the type A, go-getter, ambitious, etc., etc., who has conquered every other available
looking for a new challenge.
STEM course, and the top is medicine and surgery, and that's what you want to take. So it is a continuous selection process that by the time you are getting to specialization, you're already looking at a different league, so to speak. So if you could water it backwards, you might find, but I don't think there's an answer. But in my second book, I speak about something called the idiosyncrasy of neatness.
Idiosyncrasy of neatness.
As an opening to my second book. And my second book, which is not yet out, what I'm writing is premised on a few things, like the way of the surgeon, a few idiosyncrasies and ways of doing things that we surgeons have been socialized to adopt, that then we kind of find ourselves adopting in our day-to-day life. If you walked, for instance, into a surgeon's office vis-a-vis another specialist office, might you quickly tell, this one looks surgically set, for instance? And I give the example of the idiosyncrasy of neatness as the starting point.
So what is idiosyncrasy?
So idiosyncrasies are like mannerisms or behaviors or proclivities to what you find yourself doing. And I give a case of a colleague who actually told me that as you grow in the profession, you tend to have your own idiosyncrasies and your own rhythms that you work with. And this is what works for you, and it percolates your private life, not just your professional life as a surgeon. So if you've operated with surgeons, you see someone who wants their way this way, who wants this done this way. But granted, one of the things we look at, which we keep swinging about, is, the neatness, the economy of movement, the respect of tissue planes, the precision of cutting, and all that, swift movements and all that. So those can come to people, so you find them methodical and all that. But what I speak really is the idiosyncrasy of neatness is just as an opening to saying there are other idiosyncrasies. So whether the neatness is in the dressing, whether the neatness is in the dressing or the arrangement of the room, or whether the neatness is in planning your weekly plan or your calendar, or you want your things to be done in a methodical way, not out of that way, you find it picking up. So I am saying that because, like we agreed, is nature nurture, and over time, much as the nature may have brought you here, there is a lot of way that then the training and the work of being a surgeon can now shape your future life in all spheres.
So you can evolve.
I think become a surgeon. Yes.
As you train.
I went back and forth.
Amazing. Ladies and gentlemen, Dr. Stanley Aruyaru. Aruyaru. That's a Meru name.
Yes, it is. Not very common, but
what does it mean?
I don't know the meaning. I don't know the meaning. It's from my dad. It's called
it's a family name.
So that's my surname. My family name is Mto Aruyaru. When you are in
So it's not
Tigania.
like a Meru anything, born during Ruyaru season?
I don't even know what it means. I've inquired, I don't know. So
don't worry, I also don't know what mine means.
Very good. You don't have to know everything.
Yeah, true that. So, Daktari, you've mentioned books. So, Daktari is a surgeon, Daktari is an author. What else?
The ones you have said.
There is more. More.
So Dr. Aruyaru is a medical doctor. I'm a medical doctor with 14 plus years of experience.
14?
Yes, 14 plus years of experience.
That's from
the time I graduated. From the time I graduated with a license number. And over 8 years now as a consultant surgeon.
14 years. This is
I graduated 2010. Yes, I graduated 2010.
Okay.
And
so you're as old as our constitution.
Yes. we promulgated the constitution, then we sat the final exam. So my medical career is as long as our constitution. And my area of specialty is in general laparoscopic surgery. And I currently practice as the chief medical officer at PCA Kikuyu Hospital. So I have an administrative duty and I also have the clinical duty. Today I am from the office. If you met me Monday, I was in scrubs because that's my theater day. Tomorrow is my clinic day. So I run clinic on Wednesday, theater on Monday, Tuesday, Friday office, and then on Thursday I'm bled. Do a ward round in the morning and I do clinical work thereafter. But besides that, I also serve as the Secretary General of the Surgical Society of Kenya. But you asked that I speak and I write and I do several things. So I like to say that I sow for impact. Sowing, like kupanda mbegu. Lakini si ile ya that guy.
Which guy?
Like kupanda mbegu.
Si ya Kanyari. Si ya Drita.
Yeah, so sowing for impact is for speaking. So I love to speak.
It's like a mnemonic.
Yes, it's a mnemonic. So S is for speaking. I love speaking, whether it's on podcast, whether it's on TV host, whether it's on my YouTube channel, something about surgery, or any other forum you
have a YouTube channel called Something About Surgery.
I have a YouTube channel called Something About Surgery, which is distilling some surgical topics for the lay people.
Oh, okay.
So
not for like teaching.
No, not necessarily. That is for that. Probably for teaching, it will come another time. So that is speaking.
So
then O is for operating. Operating the surgery, isn't it? And I've said I'm a general laparoscopic surgeon. And then W is for writing.
And writing.
W is for writing. So whether it's writing newspaper columns, whether it's writing my blog on aruyaru.com, whether it's on my social media platforms, sharing opinions and all that, whether it's formulating policies, if I get those openings, that's really my area of what amuses me, what I would love to do. I would love to, draft a policy here that improves the access, that improves the safety, quality of surgery in the space we are in and even beyond the boundaries. So writing really spreads across those newspaper articles, opinions, magazines, blah, 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 blah. And I have my book is titled The Chronicles of a Village Surgeon. You can pick it on Nuria store. It's an online store. And then I have my second book, which is not yet complete. I really had wanted for it to be done by end of last year, but I couldn't. And I'm hoping by mid of this year I would have finished my bit and then I submit it for publishing. You said the
introduction. You talked about the introduction, but what's the name of the book?
No, I haven't given it a title. I prefer to do the title as the last thing. Sometimes you share with the editor or the publisher and they edit for you and they're able to tell you, maybe we tweak the title. So yes, I have two possible
candidates
titles, but I would do a lot of reviews with the editor and find out which one would be more applicable. Yes, but what I mentioned is actually the heading of the introductory chapter, which is the idiosyncrasy of neatness, which introduces all this concept of what are those mannerisms of surgeons that you can pick, for instance, and apply them. And apply them. So I will be excited really to share that with the world as soon as I'm done with it.
We're looking forward.
Yeah, absolutely. If the economy of the big boss improves.
Wait, so you wrote, when did you write your first book?
The Chronicles of a Village Surgeon came out in 2021.
2021, yes. After COVID or during COVID? That was
during COVID. We launched it virtually.
But you had been writing it, how long did it take?
I'd been writing it from maybe 2019. So it's an anthology of shared real life experiences with patients. And I started initially by a blog. Sometimes I would share patient experience that touched on our healthcare system, our healthcare delivery, the challenges we have, be it on access, financing, quality, so all those.
At that time, 2019, you were already a surgeon?
Yes, I was. I graduated 2016 as a surgeon. I concluded my training in 2016.
2016. Wait, you finished med school in 2010.
Yes.
In a span of 6 years, you're already a surgeon.
Yeah, surgeons are impatient. I told you, remember?
Wow. How is that? So I think med school, then internship,
then residency.
You didn't do what some of us are doing right now.
I did what some of you are doing right now. I only did it for 4 months.
For 4 months.
I was posted. I did my internship in Consolata Hospital, Meru. It's a faith-based facility. When I was done, at that time, the provincial medical director or the provincial medical officer of health, we used to call them PMO, would post all the interns that had finished and post them within the province. That time we didn't have devolution, right? So it was managed from the MOH, the good old
without tamaking.
Without tamaking, automatic absorption. My payslip used to have a retirement date. Permanent and pensionable, I think it used to be 2050 something.
Immediately after you finish
Once
internship.
You get it, you could always see the projected retirement.
Wait, that's during internship?
Yes. The payslip would have the MOH logo. I don't remember how the current one looks, but nonetheless. So when we finished, our unit or our station was late to submit our names to Afia House. To the provincial medical officer.
That's Consolata now.
Yes. And it meant that beyond this deadline for the province, we have posted. So the remaining centers will submit their names to the MOH. And now you will be posted from the MOH. So the 4 of us who were in Nyeri were posted to far-flung areas of the country. My colleague was posted to Marsabit. The other one was posted to Maralal. There was a lady who was posted to Koibatek. And I was posted to Kilgoris, Transmara, in Narok County.
Places you would never want to go.
Yes. So, when I went there, I reported beginning of June. Then I started my interview for residency beginning of around August. So, I had just worked two months.
2 months.
Then August, I did the interviews. Then by October, the feedback was out. That I needed to come for residency. So I essentially worked June, July, August, September,
as an MO.
And October. Then by November, I tabled my resignation and came back
to Nairobi now.
Yes.
Wait, you're done your undergrad in UN?
No. Moi University.
Oh, UN Moi. They're now struggling Moi.
They're now struggling.
Well, at that time, were you taking 9 years?
No. That time we took a record 6 years.
On the dot.
The University of Nairobi had reverted to, and transitioned to a 5-year program, which didn't work.
Yeah, I remember
so
it
reverted to the 6-year program. So while the University of Nairobi was in a 5-year program,
you guys were doing
we were still on a 6-year program.
And it went uninterrupted.
It went uninterrupted.
No strikes.
We will do Monday, we will do January to December. In medical school, you only have a long leave. It's a trimester. You just finish your exam today, and next week is second semester. So you just go, wash your clothes, watch movies, and then wake up and resume for the second semester.
You never had strikes? For us, we had lots of strikes. Had student strikes, doctor strikes, nurses strikes. And I don't know, it seemed like a bad thing, but we really gained a lot of out-of-hospital experience during that time. I mean, we used to play football, used to now, enjoy ourselves.
Yes.
Well, it was a good thing because we ended up taking 7 years, but in retrospect, I think...
I see. In our time, we didn't have strikes. Thank
amazing.
God we didn't have, I don't remember any lecturer strike. It was in the first term of, the Kibaki government.
Kibaki must have been a really good
So I
president.
think they were a little more civil and all that. So things worked for quite some time. Even after the post-election violence happened and Eldoret was heavily affected. I remember things eventually quickly settled down. And we still were able to finish our training without major disruptions. And remember at that point, the doctors in Kenya were not unionized.
There was no union.
They were not unionized.
Yeah, I was with Nisikela. I was telling me the union was formed in 2011.
Yes, and you read my article. Is called "From a Dream to a Resounding Reality: The Inception of the Kenyan Doctors Union." I published it in 2012, immediately after internship.
Where is it published?
And it's in the Pan-African Medical Journal. And it depicts the struggles and the starting and all that, because people used to be frustrated. In fact, the union started as a Facebook group. It was called United Against the Poor Pay of Interns. It was founded by, I think, who was there? There are a couple of colleagues. I don't remember them offhand, and I might misquote, so I won't quote names.
You were in internship yourself at that time?
No, that time I was in medical school. As a final year medical student, this is the Facebook group. There was no WhatsApp that time. This was the Facebook group called United Against the Poor Pay of Doctors. And it was started by a few colleagues in, I think, Bagavi. And then the senior medical students joined in anticipation. So when we finished medical school, as we waited to be posted, there was still an issue with automatic posting, because we graduated in December and we started our internship in April, when we had anticipated we would start problem by end of January or beginning of February. And we had to do a march to Afya House to demand our posting orders, Now, the momentum was gaining traction. The founders, Kina Onyimbo Kerama and the rest of the team, I think he had just cleared his internship, because Onyimbo Kerama was my senior in undergraduate. He was 2 years. When he was 6th year, I was 4th year. So by the time I was an intern, he was already an AMO. I think he did internship in Thika, if I'm not wrong. But what gave life to this is the Constitution of Kenya, 2010. And the article on free association, joining
legalized unions. And
so it legalized unionism, even in an area that had been stifled. Because now you couldn't come and pull essential services card, because the mantra in law is anything that is inconsistent with the Constitution is null and void to the extent of the inconsistency. So that's how KMPDU was formed. From an activism Facebook group, and then the team started moving. Some of them would meet in Total Hurlingham, others would meet where all mobilization was going on, all that. I remember the founding chair, Victor Ngani. I think he was the founding chair, he was the founding chair. But I think now they were around mobilizing people, telling them, please register. I still remember setting my M-Pesa. It used to be 1,030 shillings. 30 shillings is for transaction. I think I sent mine in February or March of 2011.
That time you were an intern?
As I was joining internship. And when the DU numbers came, I was like, I must be among the first 100. But I think the arrangement of the DU numbers was not chronological. It was first by neck, then branch officials, and then now the rest of people chronologically. So my DU was 100 and something now. Yeah, so essentially we didn't have strike because there was no KMPDU at that time.
No one to take you on strike.
There was no KMPDU at that time. Then if students had to go on strike, we were in a 2-school campus. The medical school College of Health Sciences was domiciled in MTRH, Moi Teaching and Referral Hospital, which is tens of kilometers from the main campus in Keses, and tens of kilometers from Chepkoilel, which was the other campus, and the West campus, and the School of Law. So when people would strike and proceed on strike, a student strike led by the student leaders,
medical students would
we were buried in anatomy and Ganong and Lenija and Addison's, all those books, So we didn't do that. We really stuck to the
But then it made your career, your progression really flawless, smooth. 6 years.
Say that.
I don't think I've had. I don't know. Maybe I've never asked the other guests, but this is the first time I'm hearing people going without strikes. Because for us,
God favored me, because in my high school, I think we used to go on strike every
school.
Term.
High school.
I think I'd got like 12 strikes in high school or something like that.
High school.
Yes, it was bad like that.
Where did you go to high
I went
school?
to a school called St. Cyprian High School.
St. Cyprian?
St. Cyprian High School was a provincial level school. Now I think it's county level.
Do I know that?
It was provincial level school in Meru County, in Tigania sub-county.
There's this Churchill comedian.
Churchill.
It goes Jasper.
MC Jesse.
MC Jesse.
So MC Jesse was, I think, 2 years ahead of me. MC
yeah,
Jesse
MC
actually
Jesse
trained me. MC Jesse trained me. He was very good in drama. And I remember him, our drama teacher, delegating for him when he was a senior student to train us in the dramatized choral verse for the law club, and he went up to all the way to the national level and all that. So yes, I know MC Jesse. So yes,
you were in the same school.
We were schoolmates.
Nice.
Yes, but I think he was in Form 4 when I was in Form 2 or Form. Yeah, I think he was in Form 4.
Yeah, because he mentions that school a lot in his skits on Churchill.
Okay. Yes, St. Cyprian. Yes.
Yeah. Okay. So you went on strikes a lot in high school?
Yeah, we went on strikes a lot. It was the ignominy of having had a very nasty strike in 1991. Initially, it was mixed. And then they had this nasty strike, and I think 19 girls lost their lives during that strike, whether through stampede and trampling on.
So it was a mixed boarding school,
and a dormitory was set on fire. All that. So it was a mixed boarding school called St. Kizito. Initially, in July of 1991, they went on rampage. Lives were lost. The school was closed down, and then it was reopened as a boys-only boarding school. And then a girls' school called St. Angela's, which was like 4 kilometers away, was open now for the other girls. Students. And it has taken a life of its own. And now St. Cyprian continues as a boys-only school, and St. Angela's continues as a girls-only school. So I went to St. Cyprian, and every so often there would be all this manner of, unrest. Is it the entertainment was not okay? We don't want things. We don't have we want a bus. We want our entertainment.
It disrupted
We had all our own problems. We had all our own problems and enough share of strikes. Up and until towards the end of Form 4, so much so that we couldn't do our mock because we went on strike. And you feel frustrated because you are just clinging to that hope that once I'm done with this high school, man, I just need to be done with this so I can get university education and secure a job. This story of saying, I want to do what I want, I'm passionate, that was a myth for us who have struggled to come out of really humble backgrounds, which is euphemism for poverty.
Wait, so you're from a humble... Wait, this is the story of high school. So you managed, because I know to get into medical school, you just mentioned you're from a humble background. So I presume there was no parallel for you.
No, there was no parallel. What is parallel? What is parallel? What is parallel?
So despite all those strikes and the humble background, you managed an A?
Yes.
Damn, you must be very smart.
Doctors are smart. I started by telling you doctors are smart.
But you see, you can be smart, but the environment you're in does not allow you to be that smart. Does not nurture that out of you. Because for me, if I went to a day school, for example, in my high school, probably I wouldn't have gotten the A that I got.
You should read Dr. Mugire's book. It's called Born to Win. From Kirongorori to Harvard. He speaks about how he did his education in a day secondary school in Kisii and came to Moi University. He was a year ahead of me and a very good friend. Now he's in the US. But yes, so we did possible. That. We couldn't even do the mock because we went on strike. And when I went home now, I was the laughingstock of my peers in surrounding schools. Hey, you guys of SIPO. SIPO is the sheng we used for St. Cyprian. You guys of SIPO were afraid of the mocks. So you went on strike. You're like, okay, fair enough. Guilt as charged.
But that used to be the thing. Though,
when we resumed that term, now we were done with, suspension, disciplinary hearings and all that. Now we are back. We've resumed. Then the teachers went on strike. You remember that term? That time, Nganga used to be the SecGen of NAT. And now this was the heat of the campaign by the NAC before the Kibaki Tosha, NAK of Kibaki, Kijana Wamalo, and Kalukingilu.
This is 2002.
2002. And they kept saying, when we come to power, we will pay the teachers in 100 days. And then Moi would say, maybe nastahabu. So it was like really a kind of it was looking like a stalemate. And
so teachers were already on strike.
For the longest, after we came back from the strike, suddenly teachers are on strike, and we are on our own. Up to and until just the week before our exams started, when the area education officers had to come to do the trials, planning to invigilate the exams, because the secondary school teachers have gone on strike, the primary school teachers have gone on strike, KCSE is starting. Now the education officers have to come from the offices and supervise the exam. We even did a rehearsal. They used to be called a rehearsal. We did a rehearsal with area education officers as the invigilators.
No teachers.
Then during the Kenyatta Day, because always the exam used to follow the Kenyatta Day. After the Kenyatta Day, the next working day is the start of the KCSE. During that Kenyatta Day, then a truce was called and the teachers called off the strike. So we got the rehearsal with the area education officers and then we started the exam with now our teachers who are back. So for this period of time, we were just all over them. We were like, okay, fine. At least I can do my self-directed learning or self-directed loitering.
It's mostly loitering.
In my own way.
It's mostly loitering.
Self-directed loitering. But granted, we did the exam and then the results used to take forever. It wasn't like after Matiang. Man, you finish your exam by November. So there are a few remaining days in November, the whole of December. Then January, you're doing nothing. Then February, you're doing nothing. The results are coming end of February. So you go from optimism to ambivalence, to pessimism, to like, I don't even care what the results.
You already forgot that exam.
So when eventually it came out, I had scored an A. It was the first A for the institution.
The school,
for the school. And even at the moment, I am the only medical doctor. Then of course, you will get PhD holders. So it was like, thank God, because you go from a point of saying, the way it went, I think I will make it. I think I will get it. Then you wait and wait and wait, and your optimism starts wearing out. And say, God,
the wait just makes it.
Here, even a C+ can come, And then you just wait and wait. And what used to console me is the understanding that they would do weighted averages so that they won't always score you and say A is 80 to 100. Because if everyone has scored, if the top is 70 something, then they will make that the A and then titrate it backwards. So I'm like, I hope I will be in the top percentile so that it becomes still an A or something like that. So that is how it happened. And then after that, the letter came from Moi University to go for MBCHB.
Congratulations. I mean,
you should have brought them in 2003, but
it's still, I don't know, would you say that's your biggest achievement? Because under those circumstances, I mean, and then you score an A. You're competing with people who are in Kenya. I've just seen, actually, KCSE results came out today.
Really?
Yeah.
I haven't seen them.
And Kenya High is top there with 70 what A's. You see? And then you from somewhere in Cyprian with all strikes and all that. Don't you think that will be your greatest achievement? Because now when you come to Moi University, you're all the same circumstances.
I think so. Yes, you agree. At that moment, life is seasons.
I know.
So for that moment,
it is.
That was not just the greatest achievement. It was a life-defining achievement.
Yes, because it now defines your life. Because that
defines what you do. And I have always held the same philosophy that you can perform average in KCPE or Class 8 or primary exit exam, and still resuscitate yourself in secondary school.
Exactly.
But what you score in your secondary exam is what determines, do you go to sciences, do you go to arts?
Exactly.
Do you get a degree, do you get a diploma?
Do you go to diploma? Exactly.
Because there used to be a cutoff. During our time, it was a point of 64 points.
Yeah. I think
A
even
B,
around,
a B of
even
64
us,
points.
it was around that.
Now it's just been said
it's C+.
C+ and above you go. So the story of parallel now does not apply unless you actually choose to go to a private or university, unless I'm wrong in that model. But now there was like anyone with C+ and above transition because we are not going to peg our admission rate to maybe the bed capacity or library capacity, whatever capacity they were using.
Yeah.
So yes, that was the most important thing to do. That needed to be done. Otherwise, I would be a mechanic. I'd go back to being a mechanic.
Were you had a passion for mechanics?
No, my dad had a passion for mechanics. My dad's pocket wanted me to be a mechanic. And now I call myself the human mechanic. When I finished KCPE, my dad didn't have money.
That's KCPE.
Yes.
In high school, did you want to be a doctor? Did you know that you wanted to be a doctor? Because I remember I used to do a blog. I used to write about doctors. That's similar thing.
You need to write a blog when you're in high school. Hey, man.
No, not in high school, when I was in campus. I used to interview doctors, similar to what we do here in Dr.
What doctors in campus? There are no doctors in Maseno.
No, see, our lecturers, doctors around, that was Kisumu.
Oh, okay.
Doctors around. So there's this dentist I talked to. He's called Dr. Vitalis.
Vitalis Ogola.
Yeah, Vitalis Ogola. And he told me that when we were talking, he said, you cannot become what you don't know. Okay. And I've always remembered that because, so when people in the village, sometimes those really remote villages, you've never met a doctor.
Exactly. Yeah. And that speaks to me. In fact, when I was growing up until I went to high school, there was only one person with a degree. We used to walk when he has come for the school holiday. For the holiday to see how a person with a degree looks like. We used to think a degree is like an ornament that you will be carrying around. I didn't know a degree is a certification in a form of a paper to objectify your certain training or something like that. So Ogola was right in that the extent of your horizon the extent of your imagination can only be built by the people you have interacted with. So I grew up in a really disadvantaged environment because there was no doctor to look up to. Yeah. I used to travel for kilometers during these seasonal bouts of diarrheal disease or what was Christian malaria, which I never knew whether it was malaria, to go to my health center where they would boil the syringes in a boiling sufuria and inject me with those funny antimalarials. And the person we met there, we said, that is the doctor we met, but it was a nurse.
Exactly.
Or a clinical officer at the most. Yeah. But when I finished primary school and the letter from my secondary school came, my father went to pick the letter because the teacher said, I'm not giving you, tell your father to come for it. And my father went for it and they asked him, so where are you taking this guy? He's like, this guy is going to the village polytechnic, not the TVET, the village polytechnic, the one for artisans. When you finish class 8, you can go to the village polytechnic, and in 6 months you've learned something course.
You can
so that is what he could afford. And they say you cut your coat according to your cloth. Even if you are
what did you get in KCP?
501 out of the 700.
At that time you were doing 7 subjects.
And it's a record that stood for 13 years. So based on the location and the capacity and the infrastructure or the support. So they told him, no, you can't do that. Don't deny us our first ever doctor. So maybe that's where the seeds of imagination were sowed. And then he came and said, you know what? You guys say your thing, this is what I can afford. This is where I am taking him. And we had a shopping. We picked that kasanduku and a few things and a panga. And then we were ready to report to the village polytechnic.
Panga was one of the requirements.
There's that list of the things you need.
Panga. Oh my God.
You were not asked for a panga when you went for high school?
No, maybe a hockey stick.
A walking stick for what?
Hockey stick.
Hockey stick.
Yeah, there are people being asked to come with hockey sticks.
You see, there are group of schools and then there are school of groups where you study in groups under a tree. So I was in the latter. You were in the former. So those are problems for the groups of schools. Anyhow, so I went. I was actually ready to go to the village polytechnic. So I commuted from my village, which is like a 7-kilometer commute, to the nearby shopping center, and we got accommodation at that nearby shopping center. So that now on Monday morning, I would wake up and walk, less than 20 minutes walk along the tarmac to report in the village polytechnic. And then that morning, the parents and the teachers got wind of the developments, and they sent someone to stop us in our mischievous ways.
You and your dad heading to a polytechnic.
So I was taken back and told, no, you're not going to report there, come back. So I was like, what's happening? The parents and the teachers have said they're conducting a Harambe so that you can report Form 1. So that's how it happened. I reported Form 1 in March, and the rest of the people are coming back from midterm. It was so late. But my slot was already there because I think I was the first pick for the school because of the score. So when I came to secondary, the teachers kept saying, our university has produced every specialty. Teachers, engineers, blah, blah, except a lawyer and a doctor. And I was inclined to sciences. So I said, there's that. Bring it on. Hold my drink. So we started chewing the books.
And you chewed proper.
And we chewed.
And here you're so
and
very
eventually
inspiring.
we made it to medicine.
Very inspiring.
Yeah, so I don't know whether I knew it or what. I think it was just the ambition. I remember in class 4, one of our teachers asked us, they just went around, what do you want to become?
Class 4.
I just remember that. What do you want to become when you grow up? People said this, people said this. People want to become a teacher, become whatever, like you are saying. People you can relate, people you have seen. Yeah. I said president. I'm like, that time there was no social media or internet, so there's nothing to go back and tell me, look, this.
Oh my God,
yes.
president.
So anyway, I guess it was just
a pilot.
It was just you can still become a pilot. Come on. Look for money. Go to the school of aviation. No. Then you start heading your hand to a Cessna.
I think it was just the fun of seeing something flying up there.
Yes.
I mean,
yeah, absolutely. I think it's George Bernard Shaw says.
George Bernard Shaw.
Yes, it's an Irish poet. It's an Irish playwright. And he says, he has several quotes, but one of them that relates, he says, every profession is a conspiracy against the lay. So if you look at medicine, if they come so far, there is nothing fancy. So everyone can say what we have been saying.
Yeah, exactly.
But the moment we start writing those handwritings for those who have bad handwriting, for the record, I try to have a legible handwriting. So for those who have a bad handwriting, and we start saying DX, RX, PRN, TDS, everything. Now people start getting wowed. And then they see the scraps and they hear the language. And like, okay.
And afloat.
So that is what attracts them. So even you, I'm sure, when you get there and you see the captain's attire and how they are dressed and they are taking controls at the cockpit, and the like, communication and the closed loop communication, you're like, that is...
I would want to do that.
That one is exciting. It's conspiracy against the laity.
Yeah, exactly.
So I'm sure you could go there and then say, oh, this was it. Let me go back to medicine.
Good. Now let's conspire against the lay kidogo also. Let's go back to medicine.
Yes.
So when you say Chronicles of a Village Surgeon,
yes,
Kikuyu is not a village.
No, but I wrote it when I started writing it when I was in Nyeri. And if you read the book by... It's called Cutting for Stone by Abraham Verghese.
Doctor, you've read books.
Abraham Verghese is a professor of internal medicine in Stanford. And he writes in Cutting for a Stone, he tracks a missionary surgeon who comes from rural India during the colonial times, settles in Ethiopia, in a village, in a mission hospital, continues working, and then he takes off, never to be seen, sneaks into Kenya, and takes a flight to the US and goes there, and he is received as a very serious surgeon and starts even training residents there until one of his sons starts looking after him after he has grown and become of age, and goes there also and trains. It's a funny story. And then, so they used to call him Dr. Stone FRCS. Now, this is classified. They used to call him Dr. Stone FRCS. And one of the colleagues used to have this teasing and banter. I think he's the gynecologist in those characters. So, FRCS is supposed to stand for Fellow of the Royal College of Surgeons. So they will tell him, you're Dr. Stone, farting around the countryside. Now, at a point, I was like, FRCS, it's funny things. So I was like, okay, I'm a village surgeon FRCS. Actually, I was very busy in Facebook, no matter. I was very active on Facebook, no matter, those times. And I would say village surgeon FRCS, because I was in the village at that time. Nyeri was village. It was where the sickest would come. Where I would imagine if this came to the tertiary level where I operated when I was in training, this would have been a difficult issue. But now, is in the extremes where I trained, people would come early. So even for what you are told, this appendicitis, it would come within 4 hours and the signs are not clear.
You're not even sure it's appendicitis.
You're not sure, so you have to do CT scan. Have you done a urinalysis? In the village, it has spent 24 hours or 36 or 48 or 72.
Or it comes with peritonitis.
So it is screaming at the door.
Or it's ruptured.
Everything is telling you, I am here. And you look at them, man, the first time I landed, my theater list was purely chronological. I would tell everyone, the interns, write for me the theater list for everyone who is in the ward waiting for surgery, and one column, write date of admission. Because at this point, everyone is an emergency. And the only clear and just mechanism of triage is the date of admission.
Fast. Wow.
Because what else?
It was that bad. Wait, so they would...
And I went in during
emergencies would go to the ward?
Yes.
Instead of going to theater?
Yes. They are waiting there. Or you have an open fracture, it has under surgical toilet, but there's a second surgical toilet waiting. There's another guy on traction waiting for fracture fixation. Another guy with a bowel obstruction who is not responding to conservative management. All of them, as it stands there, belong to the emergency list.
Exactly.
And when I went there,
everything is an emergency.
It was during the 100-day doctor strike.
Oh, the lipa kama tenda.
The lipa kama...
that was the 100 one.
The lipa kama tenda. Dr. Obonyo and myself wrote an article in the World Medical Journal.
Dr. Obonyo Lawrence?
Yes, Lawrence Chafanso Obonyo. Not Lawrence. Chafanso Gikenyi Obonyo. He's in Australia. We wrote a letter about, we wrote an article about, the experience when finally the 100-day strike came to a halt. So this time, when you're there, essentially, elective services are kind of suspended, and the hospital is bursting at the seams with the emergency cases. Anyhow, I was rural, everything was like, okay, those are fancy things, but here, this is where we are, this is what we can work with. So I started calling myself the village surgeon. I actually used to sign off hashtag village surgeon FRCS, and I didn't want to write the FRCS in full, borrowed from Cutting for Stone. But nonetheless, when I started writing the cases now, like this is a case study of this patient that I've gotten. That is not. So
you are writing case by case on Facebook.
Case by case. I would do an itemized Facebook post or a blog on my website, and then along the way, when I got married, my wife was like, "Look, you write these cases in your blog and all that. Why don't you compile them into a book? And you can even compile 40 stories for your 40th birthday." That is a fossil. Anyway, so we targeted 40, But we didn't hit 40 because I gave myself a beacon and a timeline within which by this time I should be done with this. Otherwise, it will just be analysis and paralysis by analysis, and you're not moving.
Publish it,
so eventually, I did 28, and after I published, I've done another so many that I don't know if they will. Eventually, I will get a package to publish, but my focus now is to do this other perspective, like I spoke to you. So that's the reason why I called myself a village surgeon, because in Nyeri and in Meru, it was a village for sure. There's one thing I usually really miss about Meru is I started collecting data. I used to call it the distance covered to see a surgeon. And you would see people coming from rural Ukambani Mwingi, off the Rakanidi, from this side of Marsabit, I don't know if it's Madeira or Moyale. People would come from Ethiopia and cross over to the Kenyan side.
Really?
And then come. People would wake up, walk to the nearest rough road on a market day, because that is the day when the matatu comes in the morning and leaves. Maybe there are only 2 matatu that ply that route on the market day. So they will go that day, take the matatu, and go to the next sub-county headquarters, which then they have a frequent matatu. Then they will sleep there. Then they will take now that matatu and come to Meru town.
This person has appendicitis.
Or elective. It could be anything. Then they would now come and sleep around Meru or around Isiolo. Then now in the morning they will come. So when I see them and I'm giving them an appointment, they're like, Daktari, you can't send me for this scan and tell me to bring the results after 2 days, because 2 days is
my journey.
So now I have to align. So it was looking really, really weird. And I had started saying, okay, when did you start coming? Where did you stop? How many kilometers? But I knew, in my mind, I would now geotag them. I would ask them, what is your village?
You were collecting data.
I was collecting data. Then I went on leave and then the computer crashed.
That's very
sad. God, but it's okay, no problem. So for me, I felt...
so you were the only surgeon in the region?
No, I was the only surgeon in my mission hospital. And when the patients will come, some will come to the mission hospital, others will come to the county and sub-county hospitals. So I was collecting
you were posted
my mission hospital.
You went back to Consolata.
Yes, I got a position there. I wasn't posted because I was no longer in the government. So when I was about to sit my exam, the CEO came and asked me, can you come and consider working with us? Because my colleague who was with them then had flown out to do a fellowship in Europe. So they did have a general surgeon. They had a guy holding, and they needed me to come and consider. And I went and I started. And it was easy for me because I had faces I knew from my days as an intern. We struck it off. I enjoyed working there, man. I worked day and night. We would do what? We would do crazy theaters, we would do crazy clinics. I remember, I think I was clocking how many, like 400 major surgeries a year. 400. So it was busy. It was busy. Head to toe, essentially. I used to what does a general surgeon do? General surgeon operates head to toe and refers the head and refers the toe when appropriate. So when I went to my new station from Consolata, I worked there up to 2017, 18, and 19. And then by 2020, I went to St. Teresa in Meru. St. Teresa Mission Hospital, Kirua in Meru. It's called Kirua. You will hear people say Kirua. Now, people will know. Let's go to Kirua, we'll get help. Again, it depending on the culture, depending on the experience they have had, depending on whether there are shortages in the public facility, whatever you call it, whichever way. So people would come to Kirua through that kind of a problem. And I'm sure if I sat in the county hospital, probably it would be the same issue, because really patients just want to know, where can I get the patient, where can I get the surgeon, where can I get the help? So I really understood what it means for someone to search for a surgeon in the farthest corners of the republic, in the village. So when eventually I published my book, I called it The Chronicles of a Village Surgeon, because I used to say, this is the experience I have. And now in Kikuyu, I'm tapering my village. You can't do random abrupt cut off. Even steroids, you have to taper them off.
Amazing. Wow, village surgeon. I mean, you have amazing stories, and I'm very glad that you're willing to share and talk and inspire some of us. But let's just take a short break. When we come back, now we transition from the village
To the Periaba.
to uptown.
Periaba.
Little suburbs.
Not yet uptown. Periaba.
Periaba.
Yes.
Amazing. So Dr. Cyprian will be right back after the break.